Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, the best time to eat grapefruit for weight loss, digestion and heart health. Break key takeaways: eating grapefruit before a meal may increase satiety and help with weight loss. Grapefruit may aid digestion and improve bowel movements when consumed before meals or in the morning. Antioxidants and dietary fiber in grapefruit have been linked to better heart health. Consuming grapefruit as a part of a well-balanced diet may improve certain health outcomes, especially when taken at the appropriate time based on the intended health benefit. Best time for weight loss. Scientific evidence suggests that grapefruit may help with weight loss. The best time to eat grapefruit for weight loss is often just before a meal. However, more research is needed to learn how much timing matters. Study results through the years are largely mixed, but there is some evidence that grapefruit has certain properties that may aid weight loss. Grapefruit is low in calories. Half of a grapefruit contains just 52 calories. Research suggests that consuming grapefruit before a meal may lead to lower overall calorie intake. Eating half a grapefruit before each meal for 6 weeks has also led to reductions in waist circumference. Grapefruit contains soluble fiber, which increases satiety. By increasing satiety, grapefruit may help you feel full longer and, thus, eat less food. Additionally, according to research, high dietary fiber intake is a predictor for weight loss. However, the grapefruit diet is not supported by science. The grapefruit diet is a very low-calorie diet that entails eating grapefruit with every meal. It promises rapid weight loss but is not sustainable. There is also no evidence that grapefruit contains fat-burning compounds. It's important to note that few studies have been conducted on grapefruit for weight loss in recent years. Most of the older studies on grapefruit for weight loss were small and flawed. Overall, more research is needed. Best time for digestion. Grapefruit may support digestion, especially if eaten at certain times of day. The best time to eat grapefruit for digestion may be in the morning or before meals. There isn't strong evidence that one time of day is better than others to eat grapefruit for digestion, however. Less than speak greater than less means that grapefruit may support digestion regardless of when you eat it. This is because dietary fiber found in grapefruit promotes regular bowel movements. 1/2 of a grapefruit contains 2 grams, g, of dietary fiber, a nutrient that is often recommended to manage constipation. Increasing fiber intake has been linked to improvements in stool consistency and frequency. Grapefruit contains pectin, which may reduce bloating and gas. Pectin is a type of soluble fiber that forms a gel-like substance in the intestines and slows digestion. Pectin also acts as a prebiotic and feeds good bacteria in the gut, leading to better overall gut health. Eating grapefruit may improve hydration, which is important to digestion. Grapefruit has a high water content. Adequate hydration is associated with regular bowel movements and a healthier gut microbiome. It's worth noting that grapefruit may cause digestive discomfort for some people due to its acidity. Grapefruit and other acidic foods may trigger symptoms in people with gastroesophageal reflux disease, GERD. Related stories: what happens to your body when you eat grapefruit regularly? 14 medications to avoid mixing with grapefruit. Best time for heart health. Adding grapefruit to your diet may support heart health and reduce the risk of heart disease. There isn't a recommended time of day to eat grapefruit for heart health. However, you may find it best to eat grapefruit before or during meals to support digestion. There is evidence that grapefruit may support heart health in various ways. Grapefruit contains antioxidants, including polyphenols. Polyphenols and other antioxidants fight off free radicals that may cause heart damage. Polyphenols also have vasodilator effects, which means they help widen blood vessels for normal blood pressure. Dietary fiber is linked to a lower risk of heart disease. Research shows soluble fiber in particular helps reduce cholesterol levels as well as blood pressure. According to one review, People who follow a fiber-rich diet are less likely to get heart disease or die from heart disease. Red grapefruit may lower triglycerides in the blood. An older study in patients with atherosclerosis found that adding red grapefruit to the diet for 30 days led to improvements in triglycerides and other blood lipid levels. High blood lipid levels are a risk factor for heart disease. If you take statins for high cholesterol, you may need to limit less than speak it your intake of grapefruit and grapefruit juice. Consuming grapefruit juice with statins may increase the levels of statins in your blood, which could cause increased side effects from the medication. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than speak.